Could an AI diagnose you better than your doctor? Artificial intelligence is already being trained to read scans, predict illnesses, and even suggest treatments. But can a machine really replace the human touch in medicine? Today, we explore what the future of healthcare could look like, and what's already happening right now. AI in medicine is no longer science fiction. From algorithms that spot cancer in X-rays to apps that monitor your heart in real time, technology is stepping into roles traditionally reserved for doctors. But as these systems advance, questions emerge. Can AI be more accurate than humans? And what are the risks when we start trusting machines with our health? AI systems use huge datasets of medical records, scans, and research papers. Machine learning algorithms identify patterns that a human might miss. For instance, studies show AI can detect early-stage cancers on imaging with similar, or sometimes higher, accuracy than radiologists. But it's not just imaging. AI can analyze lab results, genetic data, and even your symptoms to suggest diagnoses. Companies are developing virtual assistants that guide patients through triage, helping them decide whether to see a doctor, visit urgent care, or manage minor conditions at home. So why is AI so promising? Speed: AI can process thousands of records in seconds. Consistency: unlike humans, AI doesn't get tired, distracted, or influenced by personal bias. Predictive power: AI can flag high-risk patients before symptoms even appear, potentially saving lives. In rural areas or regions with doctor shortages, AI could become a lifeline, providing access to medical advice where there isn't a doctor nearby. And in hospitals, AI can assist doctors, freeing up time for complex cases that require human judgment. But AI isn't perfect. Algorithms are only as good as the data they're trained on, and if that input is biased or incomplete, the AI can produce flawed results. For example, if most of the training data comes from one group of patients, the system may misdiagnose people outside that group. AI can also struggle with rare conditions or unusual presentations. And there's the human element: trust, empathy, and understanding subtle nuances in patient behavior. While AI can offer recommendations, the final judgment often still needs a doctor's expertise. And who is accountable when an AI gets it wrong? This is one of the biggest ethical and legal debates in healthcare today. The most likely future isn't AI replacing doctors, but doctors using AI. Think of it as a partnership. AI handles data-heavy tasks, flags risks, and offers evidence-based suggestions, while humans focus on complex decisions, empathy, and patient communication. Some hospitals are already piloting AI-assisted diagnosis tools. In these settings, doctors using AI often outperform either human-only or AI-only approaches. The goal isn't replacement, it's better care, faster, and potentially more accurate. AI in medicine isn't about a future where robots take over hospitals. It's about smarter, faster, and more precise healthcare. The technology is evolving rapidly, but the human touch remains essential. The question isn't whether AI can replace doctors, it's how doctors and AI will work together to save lives. We've seen what happens when AI meets medicine, but what happens when we push even deeper? Into the very fabric of computation itself? That's coming next. If you enjoyed exploring the future, subscribe to Tomorrow Today for new videos every week.